With him, you're going to see that he adjusts and does a few different techniques. So we'll get into the adjustment. He already did an exam on me earlier and kind of understands what I have going on, but I'll let him walk through an adjustment of a typical adjustment that you would see a wellness patient for, somebody that's in a little bit of pain, needs some fixing. So. Hey guys, Dr. Eric Smith in downtown Chicago, and today I want to introduce Dr. Anthony. So I'm at his practice. If you've been following my YouTube channel or watching some of the videos, you've been seeing that I like to go to other doctors and show how they adjust and have them adjust me, so you can see how they can do different techniques or different certain things, and let them explain a little bit of their assessment process and what they do to make sure that they get the results with their patients. So Dr. Anthony does some more things that I do. He actually has digital x-ray at his practice that I really like, as well as a few other things. So I'm going to turn it over to him and talk about Universal Wellness Source in Lakeshore East in downtown Chicago.
Hey guys, Dr. Anthony Zapor from Universal Wellness Source, Lakeshore East. Here, our focus is spinal correction, not just getting rid of pain, but also making sure that we can prevent the structure from developing those same issues in the future. One of the things that our patients like is not only do we do spinal adjustments, but extremities as well. We have a lot of sports athletes and everything coming in to make sure that they're at the top of the game. Marathon runners, super marathon runners. And again, for patients who have things like hardware in the spine, we also can cater to them with low force techniques. Specifically something called torque release technique, which uses a tool, being able to get the results, getting rid of pain, and getting them at their optimal health.
Very good. So he sees a lot of the same patients as I do. He specializes a little bit more with the torque release technique, which is really cool for those of you that are watching the pop and crack videos, but not sure if you want that. But he does do, like I said, digital x-ray, which is really cool because you have a lot of before and afters that he puts up. So we'll put his Instagram on here too, so you can check him out, Universal Wellness Source, and see some of his correction. But the other thing I want to mention too is with him, you're going to see that he adjusts and does a few different techniques. So we'll get into the adjustment. He already did an exam on me earlier and kind of understands what I have going on, but I'll let him walk through an adjustment of a typical adjustment that you would see a wellness patient for, somebody that's in a little bit of pain, needs some fixing. So.
All right, great. Can I do your FaceTime?
Yeah.
Awesome. All right, so first thing we're going to do, we're going to start off at the end of the table, checking out the functional leg length, seeing if there's a discrepancy between length of the legs, whether it's functional or anatomical. Now when we bring the heels back toward the hips, we're also checking to see if there's any joint restriction at the tailbone. It appeared even on both sides. Before we do the adjustment, I also do a stretch from hip to opposite shoulder, assessing the tissue tone in the muscle for the patient that day. So although we do have the set ways of how we're going to adjust certain patients, we also check in visit to visit to make sure that the tone is right for them, so we're delivering the correct adjustment for the patient that day. Right here, right there. Now, there, one thing I noticed, we have a rib out on the right side. When we're comparing left to right, it appears relatively higher. And so to bring the rib back in place, we're going to raise the hand up here, relax a little back. And most times you'll hear a little click. This is great when patients have rib pain, sharp, and it wraps around to the front. Real easy fix. All right. Next thing we'll be doing is the tailbone. This is great for stabilizing the hips and the pelvis. So the first one we'll be doing is the tailbone. Depending on the patient case, there's a level of priority for what condition they have. We're going to be taking a look at the mid-back next. Take a deep breath in. And exhale. Right there. Now, between the mid-back and low-back, the shape of the actual bones in the spine create a transition point, and so we have to adjust that differently. So Eric, can I have you raise the head slightly? transitional zone between the neck and mid-back, we adjust it differently so that we're making sure we're catering to the adjustment for their anatomy.
There it was. Oh.
Awesome. Now, for leveling out the hips, taking care of the low back, I'm going to have Eric go on his right side, turn face me. So we have a patient grab their arm on the top shoulder. As it decompresses up, it opens up that joint space. So we're using less force to the neck. Awesome. Other side. That's smooth.
Good.
Nice.
Yeah, that's great. Very good. So one of the things about him is he's also a physique competitor. So you'll check him out. He definitely loves to work with people that are taking care of their body, staying active, as well as some of the other things he had mentioned. So I highly encourage you, if you're in downtown Chicago or in the area, and if you have any questions about any condition that you think you might be able to treat, feel free to write it below or contact his office. He'd love to help you out with that. So until next time, see you.